Growing up, I loved science. I loved knowing the why of things worked, but I also had instilled in me values towards giving to others. And as I went to college, I was, really exploring what I wanted to do. I went to Peru kind of on a whim, and it was a 1-month trip to Peru where I lived in a house with children with disabilities and got to take them to their medical appointments and kind of really learned to kind of hone in on, what mattered to kids and what matters to people in life. And then coming back from that, I decided, medicine was eventually that right path for me. As a provider who works inpatient and outpatient, I tend to take care of patients with spinal cord injuries, strokes, brain injuries, amputations, and a multitude of neurological diagnoses. And with that, sometimes I manage spasticity, pain. There's an element of psychology to it as well. Anyone that has an injury, illness, a car accident, any sort of disability that impairs their function. Our goal in physical medicine rehab is to help them be able to achieve and regain independence and be able to do what they want to do in life. I offer that when I get to know someone, I want to know what their goals are. I'm very honest, truthful, and I believe there is an element of transparency between myself and my patient, that I'll be honest, and my goal is to find the why of what they want to do, but also explain through their plan of care why we're doing what we're doing. I love seeing patients, see the small gains, take joy in being able to do something they couldn't do hours before, days before, weeks before. I take joy in being able to be a part of their lives and hear from family members being like, that's my father, that's the mother I know, that's my son, that's my daughter. That's something that it makes me feel, gives me worth that I'm a part of their overall care in their life.